Hello, everyone, and thank you for joining us this afternoon for Collaborative Technology and Senior Lifestyles. Before we begin with this afternoon's program, I would like to thank our interpreters, Meredith and Krista, and closed captionist Bobby, who are with us this afternoon. Because of them, we are able to make this webinar accessible to all of our alumni. If you'd like to turn on captioning, that can be done in the bottom toolbar. We also recommend changing your webinar view to side-by-side gallery view for your best viewing. This can be done by clicking the view icon in the upper right-hand corner. If you are joining from a remote location and currently signed into your company's VPN, we encourage you to close that channel during the program to increase the quality of the webinar's transmission. The webinar platform is secure and does not require a VPN access. All attendees are muted and will only be able to see the presenters during the program. If you do have questions during the webinar, please enter them in the Q&A box on the bottom toolbar, and we will address them throughout the program. Keep an eye out in that box to make sure you upvote any questions you can relate to. You can ask technical questions in the Q&A box as well. Today's webinar will be recorded and made available, complete with captions, in approximately 1 week to 10 days following today's event. All participants will receive an email with the link to the recording. Now on to our program. It is my pleasure to introduce Dr. Victor Perotti, Benjamin Forman Professor for Collaborative Research at RIT's Saunders College of Business, and our moderator this afternoon. His prior position was Department Head for MIS, Marketing, and Digital Business. Dr. Perotti is an award-winning educator, scholar, and consultant on the business implications of new technologies. His most recent research examines startup networks, business models, future journalism, social networks, social computing, clean slate internet approaches, mobile collaboration, digital entrepreneurship, electronic communities, and video game business models. Dr. Perotti, thank you for joining us this afternoon, and I'll pass on the virtual mic to you.
Thank you, Bill. I am very excited to be the moderator for this panel. I think it's an area that interests me very much, and I have the privilege of working with some great panelists, and I'm going to begin by introducing myself a little bit and then spending a little more time introducing each one of our panelists. As Bill said, I'm Vic Perotti. 2021 will mark my 24th academic year at RIT, and it has been a great ride. As Bill said, I used to be the department chair, but my most recent role is as an endowed research professor. I've been doing that for about 3 years now. And this area, the intersection of seniors and technology, has become my focal area over those last 3 years. And I've met a lot of great people, some of whom you will meet today. And I've also discovered a lot of researchers at RIT in our engineering college, in our computing college, in our College of Health Sciences and Technology, who like to share a passion for this very interesting space. So I think the possibilities for RIT and our community to work together in this area is very great. And you're going to hear some examples of that as we talk more today. Okay, so let's move on to my real job, which is to introduce and moderate this great group of people. The first person I'd like to introduce is Susan Bourne, RN and MS. Susan is the Vice President at Rochester Regional Health, Home Care and Hospice. She has been there for 6.5 years at RRH, but has been a leader in home care for over 20 years. She's part of the Extended Care Division at RRH, and this includes 6 skilled nursing facilities and the Elder One program. Susan, unfortunately, doesn't have an RIT degree, but does have an RIT connection. She's going to be supervising a group of our executive MBA students working in this important space over the next year. So we're very delighted to have Susan here. The next panelist that I'd like to introduce is Mark Hamister. Mark is the chairman and CEO of the Hamister Group. He's also an RIT trustee and has been a leader in this senior nursing home space for many years. In fact, he founded his first assisted living company in 1977. It's called P678 Lake Street. And we are delighted to have Mark with us. He is also extremely active in the community in the Buffalo, Niagara region. He is a member or officer of boards and civic organizations, including Buffalo Niagara Partnership, State University of New York Buffalo Foundation, Miami Transplant Institute, and the Buffalo Public Schools Foundation. He's also an RIT trustee, as I said a moment ago. He serves on many core committees for our Board of Trustees. So Mark, we're very grateful for that. Mark is a 1974 graduate of Rochester Institute of Technology. Our next panelist is Bob Hurlbut, a 1984 graduate of RIT. He is the president and CEO of Hurlbut Care Communities and has held this title since 1993. He was named a distinguished alumnus at RIT in 1998 and was given the Department of International Hospitality Sarah Margaret Gillum Award in 2009. He was also named one of Rochester's 40 under 40 by the Rochester Business Journal in 1995 and given the Lifetime Achievement Award in Healthcare in 2021, this year. We are grateful for Bob's participation. Finally, last but not least, Travis Masonis is a 2004 graduate from RIT. He has worked in various leadership positions in technology over the last 18 years, and he is specializing in healthcare technology for the last 14 years. Currently, Travis plays the role of CIO and Vice President of Information Technology at Jewish Senior Life in Rochester, New York. Travis oversees all technology and innovation initiatives for all 8 service lines at JSL. He previously served on the board of directors for Tech Rochester, and we learned before our meeting today that Susan also has done some work with Tech Rochester. So this is a very well-connected and very knowledgeable group in this space, and I'm excited to work with them. So without further ado, we're going to spend about the next 45 minutes talking about some of the questions that we have developed and thought of over the last few weeks and during my research over the last few years. And then we're going to open it up to all the attendees to ask questions that are of interest to them. So to get the ball rolling, I think it would be really useful to answer a pretty wide open question, which is, at the very highest level, how do you see today's seniors relating with technology? And how is that relationship changing over time during your career or immediately? And I will just open that up to any one of the panelists who'd like to go first.
Well, I'll step in and suggest a couple things. First of all, most of today's seniors, and understand that in senior care, most seniors today are in their late 70s, 80s, and 90s that are in assisted living and skilled nursing today. Most of those individuals, probably not unlike me, did not grow up with technology. My first introduction to technology in my 20s were punch cards, and of course, we've come a long way since then. It's been my experience that most seniors in care facilities today do not relate to much technology, and most of them, but not all, may need some help to even do such things as FaceTime. But as we have seen through this pandemic, the ability for the staff members of these facilities to teach our seniors how to use FaceTime, Skype, or Zoom, or Teams has become extremely important, because for months on end, it was their only connection to their loved ones. And I think that pandemic has forced many people to learn what they otherwise probably had very little interest in learning. But at the end of the day, and I can't emphasize this enough, senior care is still about person-to-person human contact. And for those of us that were marooned in our own homes during the pandemic, and it became a very lonely experience, imagine how it would have been for a senior that can't even visit with their loved one. I think that's going to change over the next 20 or 30 years as new generations go into that age group. But today, I think most seniors do not relate to most technological needs. And as a result, most technology in senior care today is probably back to the house.
And to tag on to that, I would say it also is dependent on the level of care. So certainly those elderly who struggle with dementia have even greater challenges than those who were never really exposed to technology at the level that we see today. So, you can look across different service lines at our organization, probably the organization of all of our panel members, and see that, you see folks who are in independent living who are much more apt to adopt technologies and compare them to those who are, live in a nursing home and potentially even on a dementia unit, and they're not able to adopt it. That doesn't mean that they can't realize the benefits of it with some help. But I would agree with Mark that it's a generational thing in some cases. It's just a matter of whether or not those generations have the capability, cognitively or even the, I guess the will to start adopting.
Thank you,
Yeah,
Chuck.
I have to agree with both. I think what we saw, and Mark, you hit on the head during this pandemic. If it wasn't for our staff, there wouldn't have been a lot of communication, because the elderly, especially if they're long-term residents, I found that if they're rehab and they're only with us for a couple of weeks to a month, they're in and out. And we were still able to do that. And they had family members. But a lot of our residents long-term don't have family members. And the ones that did, it was very frustrating for them at the beginning. And we were able to get some iPads and be able to do Skype and everything else like other nursing homes did. But if it wasn't for our staff to be able to help them, it would have been frustrating. And you're right too, Travis. The dementia residents, it was really hard, and we had to really focus and pick certain times of the day when they were actually most alert to be able to do it. So we were able to do it, and I think it's going to take a while for the next generation to be able to really learn technology.
And I think in the home care world, we tend to see a little different population for our seniors. And we've really seen an increased acceptance of technology in their home for things like telemonitoring. What we really find is it's important that we do good communication with them and educate them on how to use the technology and help to explain the why of why we're doing technology, so that we can help them begin to see the cause and effect sometimes of what they are doing in their home and how that relates to their health outcomes. And then once they can understand, if I do this might make me feel better, we can also tie it to their longer term goals so that the use of technology has more meaning for them. And I agree with Mark that it does not replace face-to-face interactions. It's a tool that's used that should be part of an overall comprehensive program.
Thank you, Susan. And thank you all. That's a really interesting response to the first question. It makes me think that often when we talk about seniors, we use just a single word. And in fact, they're a very diverse group of people, of course, right? Some have memory challenges, and some need physical therapy, and some are living at home. So there's probably not a single blanket answer to this. Some are younger and grew up with more technology, and some are older and grew up with less technology. So very interesting responses. We're going to get to more conversation about the staff in a minute, who obviously play a big role. But before that, I think Mark began by mentioning some of the social communication technologies that really became important during the pandemic, the FaceTimes and the Zooms and the Microsoft's Teams. That became one of the core things that the seniors needed help with and had to learn early on in the pandemic. What other technologies are important to seniors? Maybe that's the best way to ask it. It might not be something that they're actively trying to use, but they really need that technology. What would you say? What are their goals for using technology, or what technologies really benefit them?
I can chime in here.
Thanks.
First on that. So I think that smart room technology and smart home technology it really has a big place, you know, especially among the elderly. Again, as my colleagues here have stated, it's not a replacement for person-to-person care, but it does mean that if it does save someone from having to hit a call bell to get the lights turned on, for example, or change the channel on their TV, or even help working the remote for the TV, but they could do it verbally, it does allow them to gain a certain level of independence that perhaps they may have lost in the past. And maybe people with Parkinson's or people who have a little bit more difficulty getting around their room or their apartment. I think that smart room technology and home automation certainly has a big place. I think that it still is, you know, at least from our perspective as IT, or my perspective as an IT administrator in a community, it's still very difficult to roll it out to that level because it is what I'll call consumer grade technology, which means it's very difficult to administer from a central point or troubleshoot from a central point or even help control from a central point of contact. But I think that we're seeing more and more people come in with these technologies. You know, I can tell you we are seeing admissions all the time. We're asking, all right, when I bring my Amazon Echo or my Google Home with me, are you going to have Wi-Fi available for me to hook it up to? So by and large, I would say, you know, the biggest step for seniors, at least in my opinion, is, you know, the IoT and smart room technologies.
Thank you. Somebody else?
I would agree with that. I think the current consumer is looking for things that easily embed within their home. As Travis said, like with the TVs or other areas of the smart home environment, they want as much as possible one device that might do multiple things, and also that the technology that they're using has the capability to automatically send information to their loved ones so that they can be kept up to date on what's going on as well.
Would that be I'm sorry, Susan, is that the telemonitoring that you mentioned earlier?
It can be telemonitoring. It could be an Echo device, as we were talking about. It could be a variety of different things. But when that device provides information, they want that information to be able to be shared easily.
Thank you. Go ahead, Bob. Sorry to interrupt.
No, I was just going to point out, to me, it's still the communication with family members.
Yeah.
And whatever is simplest, because right now, a lot of the technology, it's complicated for them. And I'm really talking about the long-term care resident, the one that's going to, you know, it's going to be there for quite some time. And they have the toughest time. And so if we can make technology somewhat simpler for them, and I like your idea, Susan, and Travis, you know, one option, whether it be the Echo, whether it be some kind of a device that is just simpler so they don't have to think a lot. I mean, I know how difficult it is for me sometimes when I, you know, Netflix, and I got to remember my password. Well, I'm 61. That's getting more difficult. So it's hard. So if you're 83, 84, and you've not really used to this, and you're in a different environment, it's hard. So if we can simplify it and really be able to communicate with their sons or daughters that are living in Iowa or Detroit, it'd be a lot easier.
Go right ahead.
Voice technologies that are reasonably and economically viable in the senior space, I think have a lot of potential. But they need to be effective and financially affordable for it to really take off. And the biggest challenge we've found with some of those voice technologies is they sometimes have difficulty understanding the speech of some of our seniors, where we have experimented with it. But as those voice technologies improve, I think, and the prices come down, I think there's some real opportunity for voice technology to improve the environment for seniors.
Thank you, Mark. maybe it would be an opportune moment to say that Travis and I have been doing an experiment at JSL where we actually have an RIT student helping with some tech support activities. And so we have a view to some extent into what are the seniors trying to do. And certainly the technologies that you mentioned come up frequently. But Bob, your Netflix password issue is one that I think is particularly interesting. It's true for me as well, of course, and I'm 54. So I don't know, maybe it's true for all of us that we have trouble memorizing our passwords or remembering a wide variety of them. It's certainly true for my parents. I'm their primary tech support. So there's certainly room to work there with passwords, but I think considered more broadly, the area of cybersecurity and privacy is one that's quite interesting in terms of technology for this group of people. Those of you managing sort of care facilities have to deal with HIPAA regulations in terms of privacy, et cetera. But for all of us, seniors are very actively targeted by bad elements, trying to send them password discovery tools and bad emails and things like that. Have you seen some of that in your organization? And what sorts of things do you think will be helpful in protecting our seniors in that environment?
Yeah, I mean, we see it all the time. Thankfully, kind of tying back to what you noted about the partnership that we have with RIT, thankfully we do have an RIT student here, Noah, who does regular educational sessions with our elders to kind of show them and tell them what to be on the lookout for. We also do regular informational sessions with them outside of what Noah does for them, but certainly, I think that there are bad elements out there, as you said, Vic, who prey on the vulnerable and the elderly. And I think that, it's our job, caregivers, as we look after these people, to make sure that we're equipping them as best we can to protect them, not only physically, but obviously from a cybersecurity standpoint.
Well, one of the issues we face is, as you brought up, Victor, was HIPAA and the health department and what we're allowed to do and what we're not allowed to do. And even cell phones, either with family members or sometimes staff, not so much staff, but really family members, and taking pictures. And we have to go through a whole list of getting clearances. And if we don't, the health department can come after us. And so there's got to be, with technology that's developed, there has to be a marriage with the health department and the federal government dealing with HIPAA and privacy issues. We don't see scams in our homes because usually if they're a long-term resident, another family member is taken over as power of attorney. But sometimes we see it if they're coming in for rehab, and we really spend a lot of time with the families saying, you got to be very careful with your cell phone. And it's not something that we want to do, but it's something we have to do, or else we can be in violation with the health department. And that's one thing that all of us don't want to do.
Thank you.
There was some relaxing of HIPAA guidelines and regulations through COVID. And as a result of that, I can speak directly about the like primary care physician offices. There was significant increased use of technology, FaceTime, telephone calls, Skype visits, as a result of that being relaxed. So I agree with Bob. If this is really going to move forward to the extent that could really benefit patients and families, there would likely need to be some relaxation in that area around these specific topics.
Yeah, back to it for a minute. Telemedicine has really worked in a lot of our rural homes, especially with physicians, where they couldn't really go into the building. They weren't allowed to because of COVID. So telemedicine has worked very well, and I'd like to see a big expansion of that.
I think it's important to note that most of this technology, even into the future, is likely to be limited access by our residents themselves. For example, telemedicine will more than likely still include one of our nurses and other staff members. And as a result, there's a little bit more capability to comply with HIPAA rules. But it's important that what little email access our residents do use, that simply be on separate networks, and understanding that I don't think any of our residents still control their checkbooks and have any of that type of material on their laptops. And as a result, even though there's all kinds of attempts to get that kind of information, it's simply not there.
Yeah, thank you. That's an important point. Like we began with, it's a very diverse population. Many of them don't have access to that information. I want to move on though, because we haven't really gotten to, I think, the question that comes up most frequently when I have conversations with my colleagues, like the 4 panelists, and that's about staffing. I had a question planned, but one of our attendees has asked it in an even better way, so I'm just going to read what they asked. With the national nursing shortage, what technology can be used to help with administrative tasks and allow for staff for more care/time to be with elders? I think that's very eloquently put. Maybe before we get all the way to the technology part, we should say, what has this staffing shortage done to and for your organization?
Well, that's a big one. I think all of us are feeling the same thing. COVID really sent us back. I mean, the amount of reporting we have to do, which I do not understand. It makes no sense. The fact that we have to do COVID testing to our, to my 1,100, 1,500 employees twice a week, it's taken away from resident time. The fact that the New York State Medicaid rates for all of us are terrible. I mean, the nursing home industry hasn't had a Medicaid rate increase in 10 years. 10 years. And yet there's more regulations put on us. But this reporting is just getting ridiculous, whether it's to the health department, whether it's to the federal government. The testing makes no sense because hospitals don't have to test their employees. We do. And it's been going on since last June, twice a week. So we need to encourage people to get into healthcare, and we're about 35 to 45,000 people short right now in healthcare. RNs, LPNs, aides, and yet the state is trying to put more bills upon us, more regulations, and it just doesn't make sense.
Okay.
What Bob has said is just so critical. It's going to cost us all more money to hire what few people are willing to work in the senior care industry. And it's hard enough already to find people that truly do care about seniors, and it's more than just a job. But what's particularly ridiculous about the testing is that you're going to be vaccinated and you still have to be tested. So what is government saying about the vaccines? Are they really not so good? It just, and I can't tell you the number of employees that have come up to me and said, why should I get the vaccine? I still have to get tested. What's my incentive? I would get the vaccine if I could get rid of this very uncomfortable testing. I think that technology can help us a little bit. It's great with medical records administration. It's great with pharmaceutical administration. It's very effective for communicating with physicians. Allows us to communicate with those physicians digitally, all of which save time. But at the end of the day, a good 70% of what our people do is human to human interaction, for which technology cannot replace. Now, some have suggested that why can't use robotics for housekeeping? And there are robotic machines out there that will do some of the housekeeping in the rooms. The problem is that's an immediate slip and fall risk to seniors. They don't see it. And if they bump into those things, they're going down and they're relatively frail. So robotics, while they have promise in the hotel industry, I don't think they have a lot of promise near term as things exist today, in large part because they create by themselves a significant risk to the safety of residents. So it's, I personally, maybe it's because I'm old school and maybe it's because I'm the oldest guy on the panel, I don't know what it is, but I just don't think there's a huge opportunity for technology to actually reduce patient care more than what we already have. And for years, we've had the technology, even though it probably could get better, serving our medical records, our pharmaceuticals, our communications with physicians, et cetera.
Well, having worked with some engineers in this space, I can tell you that maybe like the voice recognition, the robotics could potentially get there. You could build robots that are aware of the people in their surroundings and make sure they're not a tripping hazard because they move out of the way or whatever. Your point is very well taken. Travis or Susan?
Yeah, so I don't mean this as disrespect to Mark, because he's probably forgotten more than I'll ever know. But we think there is promise in robots. I don't think it's ready at this point, but I do, all the points that Mark made are taken for sure. You know, are there risks of falling? Certainly. And we would never put anything out there that we think is going to cause problems for our elders. So we're at the very early stages of evaluating robotics, but there's some pretty compelling evidence that comes out of Japan. Now, I don't know whether their model of care is different or vastly different from ours to enable this, but there's some pretty good studies that have come out of Japan, and they use robots, you know, not only at the resident engagement level, but for aiding staff. So we're at the very least evaluating it, and we'll see what happens over the next couple of years as to whether or not we have some robots here. But you know, I think that you kind of along the same lines as what Mark and Bob both noted is that I think that there's a lot of efficiencies that can certainly free up staff in things like the electronic medical record, in things like making information available to the care team, you know, with 1 or 2 clicks as opposed to 7 to 10 clicks. So there's a lot of efficiencies that I think that can be had. It's just important to identify those problems and where the efficiencies can be gained.
And I agree with my colleagues. I would say for home care, one of the key benefits of technology is that it can extend access where appropriate for person living in their home, our patient, to have access to a nurse or to be able to share their vital signs for the day. So for an example, if a nurse is doing patient visits during the day, they can generally do about 5 to 6 patients in a normal 8-hour day, where if that patient has some level of telehealth monitoring in the home and is sharing some of their health data over the telehealth, that ratio changes in some circumstances to about 1 to 60. So again, technology does not replace that need for face-to-face personal touch visits, but it can help to extend access and oversight, and in some cases also allow the precious clinicians to provide care in a face-to-face assessment at the time when it's more needed or appropriate. So in home care, we tend to visit on a schedule based on a patient's diagnosis. If we're able to visit when the patient most needs us based on data that they're sharing with us, it can not only extend our care and make more access to it, but it can make it more effective at the same time.
Yeah, one area for me especially is your dispensing medications, the med carts, where we have, if someone is on 10 different medications, we got to go through each blister pack, put it out, put it in a cup and give it to them. But I'd like to put in someone's name like Mrs. Jones that already knows it. It takes all those pills, puts it in the cup automatically. I'm just trying to think of ways to save time. So that, and then the other thing is in home healthcare right now, or in adult homes, they can have an aide deliver medication. We, on the other hand, cannot. Nursing homes, it has to be an LPN. And we need to make some changes with that. and give them the proper training, it would save a lot of time so that the nurses could actually get to nursing.
I think also things like remote patient monitoring, where you can potentially gather some vitals without, needing, certainly, again, this is not the replacement of someone looking over someone several times a day. But if you can gather vital signs, or if you can, even if the nurse or CNA gathers vital signs in vital sign equipment, if it has the ability to interface with the EHR, so at the very least, in terms of efficiency, that data goes directly to the EHR. So not gathering them and then keying them in, which is error prone. I think there's some efficiencies there as well.
Actually, I was just reflecting on something that we began with, which is that seniors really benefit from help with the technology. And one of the challenges for staffing may be people who are able to help with technology. The staff themselves are older. One of you told me the average age of an RN is 54 or something. It's really
56.
Wow.
And the average teaching nurse is 58.
Yeah. And so they, this new job requirement that they also help to facilitate FaceTime calls or whatever might also be a challenge with staffing. We should move on. We just have a small number of minutes left. I wanted to talk maybe a little bit more about government regulations. We've already hit it, I think, in a number of different ways, the vaccination requirements and the HIPAA laws, but are there other ways that government regulations are impacting your organization, perhaps with regard to technology?
I think Bob and I would probably say that it will take us hours to have a thorough conversation on the issue of regulations.
Okay. That won't fit into the 8 minutes.
No, it won't. So I would just make this comment. My biggest frustration with regulations is that that is the state's answer to every issue which they believe is a problem, but they don't look at the regulations that have already been on the books. In some cases, maybe it just means a minor modification or improvement. And in some cases, a good 20 or 30% of those regulations that have been on the books for 30 years just simply don't apply anymore. So the state's not very good at taking a holistic look at the regulations. Instead, they just constantly add and add and add, while they either restrain or even reduce reimbursement, whether it be for home health care, for skilled nursing, or assisted living.
Very interesting. Somebody else?
Yeah, I have to agree. Yeah, I could spend a lot of time on it, but the recent state legislature with these two bills that they passed is absolutely ridiculous. I mean, I can see the safe staffing bill where nursing homes are having a tough time, and so is home health care. But nursing homes, especially in assisted living, finding staff that we're not going to be able to admit residents. So that means there's going to be a backup in hospitals, which is exactly what we don't want to see. Because everyone knows that if a nursing home resident is in a hospital for more than 3 days, it's an issue. And then we have to do a lot of rehab coming back, PT, OT. Same thing with in-home care. If they're discharged to a hospital and they come back after 3 days, there's a loss of time there. And some of these regulations just don't make any sense. COVID went overboard and they need to be pulled back. And there needs to be a sense of reality in how to take care of our residents, and just let us do what we know how to do. And that's good care. And just when politics gets involved in a pandemic, that's just the worst. And that's what we're living through. And our staff really get tired of it because they have a hard time spending time with the resident. I mean, the RNs and LPNs, just the amount of paperwork we got to fill out. And for what? It really doesn't help the care.
Thank you. Travis or Susan?
I would just add everything my colleague said about the challenges of regulatory administrative burden. The other piece I'd add for home care is that there's no, in this area, good payment source for technology. In many cases, especially with managed care, home care has to make a face-to-face visit in order to receive any reimbursement. So I think the real explosion in best use of technology for home care would be a scenario where the cost of the technology was taken into consideration and that there would be reimbursement for it as well.
And I mean, I don't have to reiterate what everyone said with regards to regulations on our industry as a whole. I think we're probably more regulated than the nuclear energy industry in the senior industry. But I will say, with regards to, because I know Vic, you had noted or asked about some comments on regulations around technology. There are some really good regulations around there around technology for care coordination. So making sure that data is being shared as someone traverses from the hospital to our facility, and then from our facility, maybe to Sue's organization at home care. So I think that those types of regulations certainly, make sense to me, not just because I'm a technologist, but also because it does put information from both upstream and downstream providers in each other's hands so that they can make better decisions as the person traverses and hopefully, recovers at home after they come through all of our organizations.
Great. So I'd like to finish by talking a little bit about the future, maybe the near future, or maybe even a little further out. We've talked about robotics already. My final question for you all will be about what up and coming technologies are going to play a role in this senior care space in the future. And I'll just throw in one of the questions that I see in the Q&A area. Is there a form of AI that's an upcoming trend for care in communities or at home?
Well, I mean, I think yes. I think that, from the business perspective, AI, is certainly applicable to understand, how are we doing with regards to certain quality measures, and what are there particular predictors that can tell us if, hey, this person may be at risk for a fall or may be at risk for a UTI based on certain other indicators. So AI, at least in my opinion, certainly has some promise. I think that, we've covered a lot of things like robotics and smart room technology that I think are going to be up and coming. I think that, as we see the adopters, which are currently people who are not utilizing our services because they're not quite at the age, but once they get to the age where they would utilize our services, I think that we're going to see a much higher level of adoption. And who knows at that time what the newest technology trends are. So if I knew the answer to the question wholly, I would probably, be betting on the stock market right now for those types of companies. But I don't know that answer for the future, other than what we know about the trends now with regards to technology and what our future consumers are going to want. I do think that things like virtual reality may hold a place in the future as it, again, develops and, we can overcome things like vertigo that it causes. But I think that the future is hopeful for sure with regards to this type of adoption. I don't know what the specifics will look like 5 years from now or even 10 years from now.
Thank you. Someone else?
I guess my big thing is with artificial intelligence is how does it really relate to the resident and the caregiver? Like, I don't think you're going to replace the CNA. The physical part of it, I just don't. Not in at least 5 to 10 years. And so what can we really do to make their jobs easier, like even in housekeeping or in dietary, to make things just easier for, besides just nursing or activities? And I agree with Travis. I think the population as it ages, they're going to be smarter. But for now, the biggest population growth is 85 right now. They're the biggest population. They're growing the most. So it's trying to be able to get technology too, so that our residents aren't scared of it. That's another issue. If they don't understand something, especially with dementia residents, they're scared. They don't like it. So I think it's a marriage of the two.
I would echo.
Mark, go right ahead.
I'm sorry, I would echo the comments that Travis made about smart home technology. I think that is something that over the next 10 to 20 years is going to play an important role and allow some minor increase of independence of our residents, except for those that are suffering from Alzheimer's or dementia. But I also think that technology may have a role in actually improving the quality of life of some of these residents. And I'm reminded of a group out in California that developed a vest that creates minor electrical currents. And they were actually developing it, ironically, for deaf students, deaf people, to be able to feel music. And what they found with this vest was when they put it on a couple of individuals who were deaf, but also were suffering from Parkinson's, is the symptoms of Parkinson's disappeared while the vest was on. Now, I think there's an enormous opportunity for technology to improve quality of life of individuals. And that just is one small example. So imagine if we were to take some of the complications of aging and use technology to find solutions to those problems. I think that's probably the most exciting area for technology today to develop for individuals, particularly those who are aging.
Thank you.
I'll just say, I think it's interesting for me. As I mentioned, I've been a nurse and in healthcare a long time. And to some degree, I could say the conversation we're having today isn't that much different than conversations that I was in 20 years ago. We weren't talking about COVID and the impact of COVID, but we were talking about the growth of technology in the senior world and all that it could do. So it's 20 years later, and in many ways, many things haven't been developed or they haven't become widespread. So I'm really interested to better understand as we go forward, have things changed so that now some of these ideas will really propel into the mainstream market and we'll really see an increase in the use of technology in a variety of different spaces that we haven't yet to date.
Yeah, good point. I was interrupting Mark, but I'm glad I stopped because what he said is something that I'd like to build on. Having started to research in this area, I found an interesting group of companies and academics also in California working on the area of digital therapeutics. So this is an application of AI where you can build virtual reality experiences or video games or other things that have a positive cognitive or other benefit specifically for seniors. And so it has been shown to address some of the impact of aging through these technologies. Really, really neat, and probably 10 years away before it will be very, very widely adopted. The early adopters are getting started right now. I feel like we could go on and talk about a great number of things for a long time, but I do want to get to some of the questions that have appeared in the Q&A section, and also I see one in the chat. Let's start with the Q&A one. Edward asks the question, the HIPAA regulations forbid medical practitioners from asking their staff about COVID vaccinations. Would you comment, please, about that?
Well, I can tell you that every time one of our employees comes into the building, whether they've been vaccinated or not, there's a series of questions that we have to ask them. Mm-hmm. So we're already doing that. And even if they have been vaccinated, everyone gets the same questions before they go to the floor. Mm-hmm. So I guess I don't know beyond that.
Yeah,
I believe that particular rule, if I'm not mistaken, was temporarily suspended during this pandemic. And I don't believe any of us know yet whether or not they're going to suspend that rule permanently or not.
Oh, good. Thank you.
On the same, kind of along the same lines, basically the way HIPAA works is we as medical provider organizations are covered entities. So that means we're certainly required to safeguard the protected health information of those that we're caring for. So our patients, residents, elders. It's an unclear area still with regards to an employer-employee relationship with, regarding whether or not we can ask them that question, because we're not their medical provider, we're their employer in that scenario. So it's still, kind of, I don't want to say uncharted territory, but there's still a lot of clarity that needs to come with regards to the employer asking the employee information about vaccinations and other medical information.
Okay, thank you. I see one more in the Q&A section, which is about wages. So I think it came up as we were talking about staffing. Of course, staffing is a big challenge. And the question from Edward is, are wages competitive, or are we still paying wages near the minimum wage?
I haven't seen a minimum wage person in 20 years.
I think I can actually, yeah, I think I'm at minimum wage.
You are personally.
You're paying yourself.
Personally, we are not paying minimum wage. What people need to understand is, if we have not gotten a Medicaid rate increase in 10 years, and yet we went through this with minimum wage increases, and even the governor decided the last year not to raise them because the Medicaid rates weren't sufficient. And now, which a couple of them I've started, a couple of them, some of the other, like Leading Age has started, NISHRA, where it's unfunded mandates. And so we're not just in competition with ourselves, we're in competition with restaurants, hotels. Ever since the pandemic has sort of ended, we can't find employees. So until this stimulus package, I hope, is done by September, and we won't have any more of that silliness, and people start to get back to work, and we'll be able to pay them. But we're in competition with a lot of other industries, and it's just, and Medicare and privates are subsidizing Medicaid, and it's in all of us feel the same way, and that's got to stop.
There's been huge pressure on pay rates, especially as a result of what Bob said. I don't think we have a single nurse's aide under $14 an hour these days, and a lot of them are earning $20 an hour if they've been with us a while. And I'm sure it's similar in most long-term care facilities today. But the pressure when you, because of these extra payments that about half the states still have not opted out of, if you're not over $15, $16 an hour, people are going to sit home.
Thank you. It also takes, as we were saying before the panel started, sort of a special person to work in this industry, right?
Yes, it does.
From a place of caring.
Yep.
So it's not just anybody choosing between fast food or this.
Yep.
Well, I sit on a board of Strong Memorial Hospital, and when other cities around Rochester are offering $20,000 signing bonuses, I mean, they're under the same pressure. And now there are programs where nurses can just go travel to any state they want for like 2 months, and they get paid like at least $7,500 a week. So this madness is we're robbing Peter to pay Paul. And when we're losing our own nurses to other states, what does that say?
Okay. So I'm going to finish with a question that I don't know the answer to, but I will try to answer it. It's in our chat window. It says, what plan is being constructed in preparation for those becoming residents? Will RIT OSHA be utilized? I'll tackle the last one, which is, I don't know, but I think RIT OSHA would be a great place to help people preparing to become residents. What do you all know about that?
I have a rather indelicate view. No one wants to become a resident of an assisted living facility, a home health care agency, or a skilled nursing facility long-term. No one.
Right.
All of us want to live until we're 99 years of age, be of sound mind, and pass away in the bed of our own home.
Mhm.
And as a result, we don't look at the long-term care facilities that might be available to us. We don't plan for it
Hmm.
until our children get that dreaded call from the hospital that says mom or dad can't go home. Now, I realize there's exceptions to that, but by and large, people don't want to be in a long-term care facility when they're in their 50s, 60s, and 70s. But unfortunately, a large portion of us, our health will be such that we will need the services of home health care, assisted living, skilled nursing, subacute in rehab, or all of the above.
Very good.
So you're not talking about OSHA, are you?
No.
Oh, good. I agree. I think nobody plans for it. And we used to have a really great partnership with New York State and with Medicaid, where you're able to keep a lot of your resources, because I don't believe a resident or resident's family should be destitute. I just don't. It's not right. But on the other hand, nursing homes, all of healthcare needs an upgrade in rates. And I think the more education we can give them, because some of the long-term care insurance products are actually tax deductible. And I look at whether it's long-term care advisor for wealth or your bank or your family, they need to have discussions when you're in your 50s with your parents. I think the more that they're educated, the smarter the consumer, the better off everybody is.
Very good.
With regards to OSHA, you mean like lifelong learning?
Yeah, that's the RIT program.
Yeah, I mean, I think we're doing, not necessarily with RIT OSHA specifically, but I think that, we have workshops and classes available more particularly for our independent living residents as they traverse and need to go into assisted living in the nursing home. There's certainly activities that, again, are qualified for that particular level of care. But with regards to OSHA, I think there is applicability certainly to independent living folks. I mean, they're still very independent. They have their own vehicles. They go out in the community. And I think opportunities for lifelong learning are always a good thing. And that doesn't mean either that OSHA wouldn't be applicable in the assisted living or in the nursing home side. I think certainly, it could be spearheaded by trying it out in the independent living side, but I think it certainly holds promise.
Okay. Well, I think I will simply express my gratitude to the panelists. It's been a very informative and enjoyable conversation. And I'm going to give it back to Bill to say goodbye. Thank you.
Yes, thanks. Thanks to all of you for your time today, Dr. Perotti, Sue, Mark, Bob, and Travis. Before we end our broadcast this afternoon, we encourage all of you to stay connected to the RIT Alumni Association via our social media channels. Karen is sharing those links in the chat box. Connect with us on Facebook, LinkedIn, Twitter, and Instagram. Also, make sure to visit our events page for future events coming up throughout the rest of this summer, covering various topics. That link is also located in the chat box. And last but not least, many of our RIT family have asked how they can help our students and the university during these times, and we are incredibly grateful for those offers. If you are able to, we encourage you to support the area that is of most interest to you. To make a gift, you can use the link located there in the chat box. Thanks again for joining us this afternoon. And remember, a link of the recording will be sent to all registrants within the next few weeks, so be on the lookout. Thank you again to Professor Perotti, Mark, Bob, Travis, Sue, Karen, and Meredith, Krista, and Bobby for making this program possible. Have a great week. Stay healthy, stay safe, and stay connected. Thank you, everyone.
Thanks all.
Thank you.
I know.